Good morning. This is Dr. Vijay Negalur from Thane, Mumbai at the EASD conference on day 3. Today we are going to run through what are the various important aspects on day 3 at the EASD conference at Stockholm, Sweden. So today the first point of discussion is that between comparison of dapagliflozin and dulaglutide so far as the outcome of stroke is concerned. We had a clear data of dulaglutide which showed reduction of stroke by 16%, and it was not true so far as the gliflozins were concerned in the previous trial. And what was compared here, the dulaglutide and dapagliflozin, and what it showed was the pressure wave velocity was reduced significantly in those patients who also took dapagliflozin, and therefore suggesting that even dapagliflozin has the beneficial effects in reducing the stroke, as was seen in the previous report that it increased the risk of stroke, the benefit of reducing the pressure velocity in patients of diabetes, and therefore like dulaglutide you have reduction of stroke incidence. The pre-diabetes is also very important from the problems of the complications. We all the time felt that pre-diabetes doesn't have any vascular complications. But here it was shown at the EASD on day 3 that those patients who have pre-diabetes also have increased degeneration of the corneal nerves, suggesting there's an evidence of a neuropathy occurring even before the development of diabetes. So it's important for us to realize that pre-diabetes is not a benign condition, and the possibility of the microvascular complications are important and we need to pay attention. It was studied at the EASD that patients who had pre-diabetes had a higher levels of a corneal nerve degeneration, and therefore we need to pay attention to treat even patients of pre-diabetes as well. We have studied in the tirzepatide trial, which is the GIP, GLP antagonist, especially in the SURPASS trial. And what was shown in this trial, with the dose of 5 milligrams and 15 milligrams, there was a change in the lipid levels. And what is heartening to see, as we increase the dose of tirzepatide, which is GLP, GIP agonist, the reduction in the lipid levels were also significant. And the dose-dependent reduction of lipids were also seen. We have not understood what is the exact mechanism by which you get reduction in these lipid levels in patients who are given GLP, GIP agonist. We still are working on the mechanistic view as to what is the reason why you get this drop in the lipids. But then it's important to realize that these drugs can also improve the cardiometabolic outcome because of the good lipid levels, and therefore they have a bright future in future to treat patients of cardiovascular manifestations in patients of type 2 diabetes. Talking about the renal manifestations of diabetes, we know that diabetes renal complications are pretty common. When you see patients of diabetes for the first time, you might have 40 to 50% of the patient could be having diabetic nephropathy. So therefore the prevention of nephropathy is a very important aspect in treatment of type 2 diabetes management. And we have a wonderful drug called finerenone. And the data was presented at the EASD meeting on day 3 in the early hours of the morning, where it showed that besides significant drop in the reduction in the control of nephropathy, there was a improvement in the outcome of these patients. And the reduction of the GFR less than 40% was seen in patients who were given finerenone. And we should also know that this was compared against glargine. So when you look at the compared glargine and finerenone, the benefit was much more larger with the finerenone than with glargine. One must understand here, with the drop in the body weight, the GFR estimation sometimes is difficult and sometimes it's controversial. But barring those points, taking other parameters to estimate the renal function, it was shown that finerenone significantly reduced diabetic nephropathy. Therefore, we have one more new kid on the block to treat patients with diabetic nephropathy by using the drug called finerenone. So there are so many newer advances that we have seen in the EASD meeting at the Sweden. I hope you enjoyed what I've said so far. With that, I thank you very much for listening to me and have a great day. Thank you very much.